Outcome measure. Parkinson's disease. It is a progressive nervous system disorder that affects movement. These are the typical appearance of a Parkinson's disease: masked facial expression, reduced arm swing, shuffling or short steppage gait, trembling of extremities, and tremors. Burge balance test is used to objectively determine a patient's ability or inability to safely balance during a series of predetermined tasks. It is a 14-item list with each item consisting of a 5-point ordinal scale ranging from 0 to 4, with 0 indicating the lowest level of function and 4 the highest level of function. Equipments required: 1 ruler, a chair with an armrest, a chair without armrest, a footstool, and a stopwatch. Demonstration. First, let the patient sit unsupported. Then next, change your position sitting to standing. Then change your position standing to sitting. Then standing unsupported. Then let the patient stand with eyes closed. Then standing with feet together. Then tandem standing. And stand on one leg. Then turning the trunk with the feet fixed. Then retrieving objects from the floor. Then turning 360 degrees. Then reaching forward while standing. Next is stool stepping. And lastly, transfer. Scoring. A score of 56 indicates functional balance, and a score less than 45 indicates individuals may be at greater risk of falling. Time up go test is to determine fall risk and measure the progress of balance, sit to stand, and walking. Equipments needed: a chair with an armrest, a stopwatch, and a tape measure to measure the 3 meters. Demonstration. The patient starts in a seated position. Then the patient stands and walks 3 meters, then turn around and walk back to the chair and sit down. Then the time stops when the patient is seated. Scoring. If a patient took 14 seconds or longer, he was classified as high risk for falling, and the cutoff scores can range from 8 to 11.5 seconds in population with Parkinson's disease. Parkinson's Disease Questionnaire. It is a 39-item questionnaire offers a patient reported measure of health status and quality of life. It assesses how often people affected by Parkinson experience difficulties across 8 dimensions of daily living, including relationship, social situation, and communication. Give the questionnaire to your patient, then explain to them how to do it, and let them answer for 5 to 10 minutes. Scoring. 5-point ordinal scoring system. 0 never, 1 occasionally, 2 sometimes, 3 often, and 4 always. Each dimension total score range from 0 never have difficulty to 100 always have difficulty, and lower score reflect better quality of life. Amyotrophic lateral sclerosis is a progressive nervous system disease that affects nerve cells in the brain and spinal cord, causing loss of muscle control. and it is characterized by stiff muscles, muscle twitching, and gradually worsening weakness due to muscle decreasing in size, and eventually lost the ability to walk, use their hand, speak, swallow, and breathe. ALS Specific Quality of Life Instrument. It is a 50-item disease-specific questionnaire that is completed by the individuals with ALS. The questionnaire has 6 domains: the negative emotion, the interaction with people and the environment, the intimacy, the religiosity, the physical symptoms, and the bulbar function. Demonstration. Explain to the patient the questionnaire and how they will answer it, then conduct the interview afterwards. Scoring. So this is what the hand score sheet looks like. An average total score for each individual ranging from 0 to 10 can be determined by summing the score for all questions, and then divide by the number of questions answered by that individual. 6-minute walk test is a submaximal exercise test used to assess aerobic capacity and endurance. Equipments required: stopwatch, tape measure, and 2 cones to mark the distance that needs to be covered. Tell the patient that the objective of this test is to walk as far as possible for 6 minutes. The patient will walk back and forth in hallway. Because 6 minutes is a long time to walk, the patient will be exerting. Then the patient will probably be out of breath or become exhausted. So the patient is permitted to slow down, to stop, or to rest as necessary. Scoring. The score is the distance the patient walks or the laps the patient walks in 6 minutes. ALS Functional Rating Scale is an instrument for evaluating the functional status of patients with amyotrophic lateral sclerosis. In the questionnaire, there are 12 questions that can have a score of 0 to 4, as 0 indicate no function while 4 indicate full function. And to make it easier for the patient, in every score in every question, there is a description to let the patient choose the best situation they are in the moment. It measures speech, salivation, swallowing, handwriting, cutting food and handling utensils, dressing and hygiene, turning bed and adjusting bedclothes, walking, climbing stairs, and breathing. Explain to your patient the questionnaire and tell them to answer it based on what they really feel and experience in the past few days. And give them 10 to 20 minutes to answer. Scoring. Individual item scores are summed to produce a reported score of between 0 worst and 48 best.